Hello and welcome. This is NTA Tuesday Live, and I'm Cyril Stober. The Nigerian federal government has approved more than 32 billion naira for disbursement to strengthen primary healthcare facilities nationwide. Announced in March 2026, this funding through the Basic Healthcare Provision Fund aims to improve service delivery, expand 5,000 more facilities, and reduce out-of-pocket expenses. Tonight on NTA Tuesday Live, guests will speak to the development aimed at improving healthcare services, especially in rural areas. But before we get down to the discussion, let's see this report put together by health correspondent Olusheye Adiagbu.
Nigeria is journeying toward achieving universal health coverage has long been challenged by limited funding, uneven access to healthcare services, and gaps in primary healthcare delivery, particularly in rural and underserved communities. For decades, millions of Nigerians relied on under-resourced health facilities, often forced to pay out of pocket for basic medical services. In response to these systemic challenges, the federal government introduced the Basic Healthcare Provision Fund, BHCPF, a landmark health financing initiative established under the National Health Act to transform access to essential healthcare services across the country. The core essence of the BHCPF is simple but ambitious: to ensure that every Nigerian, regardless of income or location, can access affordable and quality primary healthcare services. The initiative, through carefully designed implementation gateways, the fund supports primary healthcare centers, expands health insurance coverage for vulnerable populations, improves emergency medical response, and strengthens disease prevention and control systems nationwide.
We already have increases in the number of Nigerians accessing basic services from our health facilities, whether it is immunization, whether it is antenatal care. We're not where we need to be in many of the areas, but we are building transparency into what we're doing.
In a renewed commitment to health sector reform, the federal government announced new disbursements under the BHCPF targeting critical gaps.
This is a quarterly meeting that we hold to review progress that is being made in the health sector under President Bola Ahmed Tinubu's Health Sector Renewal Investment Initiative. And the resources that the federal government is disbursing through the BHCPF is getting to the facilities. We also approved the disbursement of 32 billion naira to the BHCPF facilities, the existing facilities, based on the reform guideline that we had approved last year. We're on our way to expanding the facilities to add 5,000 more that will be receiving direct facility financing. The MOC also looked at the tariff for emergency ambulances and increased the tariff rates so that others, private sector and public sector providers, can be compensated for providing emergency services.
In transparency, stewardship, and accountability with the robust involvement of the civil society organizations, and they can also help us to track and monitor at facility level to ensure that Nigerians actually are getting value for the money that the government is investing, particularly in primary healthcare delivery system.
Health authorities say the disbursement represents more than financial support. It is a strategic investment aimed at building a resilient healthcare system capable of responding to both everyday health needs and public health emergencies.
Right, that report sets the tone for tonight's discussion. Let's go ahead now and introduce our guests here. We're joined by Ben Amadu, Professor of Phytomedicine. Thanks for being here with us tonight.
Thank you.
Okay. Let me also welcome to this program Dr. John Toagbidie, the integrative medicine specialist. Thank you for joining us tonight.
Thank you, Siri.
Right. All right. Well, at some point in time, as you do know, the program goes interactive, and it means that you can join in the conversation. But when it's that time, we'll remind you of the process and the procedure. For now, let's go ahead and start talking about the main issue tonight, which is the 32 billion naira disbursement to enhance health delivery service in Nigeria. But then a good place to start is to look at how the entire health system has been funded in the past, because that's what gives rise to the need for better funding. How would you describe the whole system in the first place? Let's start with you.
Well, the argument has always been the budgetary allocation to the health sector when it is compared to the total budget of the country. And whatever we do, we like to take the WHO as a kind of mirror for the entire world, because they usually proposes how best the ratio of the budget should be. And I can recall many years ago that used to be about 3 to 5%. And there was an Abuja meeting where it was agreed that it should be modified towards the WHO. And I think since that time, that has not been, we have not been able to do that because of scarcity of resources, which has always continued to be there.
Oh, well, I'll look into that. Dr. John, I agree with you.
Well, thank you, Siri. I think this is a very germane topic, and it is actually timely. I cannot agree more with Professor Ben Amadu. In terms of figures, when he talked about the Abuja Declaration, actually they say that nations should dedicate 15% of the budget to the healthcare, sector. Looking at the Nigerian situation, where we less than 5% of our GDP is dedicated to, the health, sector. So we can say outright that something is not right, something is, wrong. And as I always tell people, if we don't get up to do it right, nobody is going to do it for us. These things are really very, very clear. Nations that have actually gone the right way have deliberately decided to do the right thing. Maybe just like Professor Ben said, as WHO has actually encouraged and then mirrored us. But if they actually mirror you and then you don't look at, the mirror, you wouldn't know how dirty looking you are unless you really look at, the mirror. That is what I would say, for now.
Oh, well, so 32 billion naira, that's to go to, enhance health delivery service. How will this funding impact healthcare access across the board?
Well, if I would comment first, it's not just the figure. You can mention any figure. But if that figure is not utilized properly, it takes you nowhere. 32 billion, yeah, it's some money. But if you don't use it properly, I will emphasize again, it will not take you anywhere. Nigeria is a country that we're well blessed in terms of human capital, financial, resources. We have what it takes. However, our problem has been that of the willpower of implementation. We can talk these figures, but we've had this over the years, over and over. Please, let's really face each other and then tell ourselves the truth. Maybe we can be redeemed. But if you just announce this year 32 billion, after 2 or 3 years, to 32 billion or even more, and you don't show us what that 32 billion has translated to, we are living in the concept of a mirage in the desert. That is what I'll tell you up front. So there is need for the government, and not just the government, the whole country to really wake up. As I said, if we don't do this right, nobody is coming to do it right for us. In the course of our discussion, we're going to discuss one of our major limitations, which has been that of corruption. If you say these things and the money doesn't go where it should go, and it is not properly accounted for, that is accountability, we're not going to move anywhere. Great. That money has been announced. Great. We pray that let's see how it will be used and translated to human capital improvement.
Well, as Dr. Media says, it's not just about the amount you are allocating for any specific cause. It's how you put it to use.
Nigeria is a very, very big country. So when you talk about 32 billion, for instance, we are made up 36 structure with the Federal Capital Territory, so we can easily say 37 states. So if you come down to divide it on the basis of straightaway units of the country, you will see that there's a need for proper planning in our health policies and proper health tracking, proper health monitoring, based on what my colleague has just said. If those planning and proper monitoring and tracking is not done, we will not go anywhere. Well, if you look at the budget cycle of various government departments, you can see repetition. Things that have been done before have been repeated year in, year out in budget presentations and in all that. And the money will just go in. If it's not properly planned and monitored, there will be no results.
All right. So the basic thing, as we said in our introduction, was that this funding would go to expand some 5,000 facilities. And of course, there's a huge leaning towards health facilities, basic health facilities, particularly in the rural areas. This probably would be targeting those. It would seem that part of the huge challenges the country has had has been in basic health access, particularly in the rural areas where most of the people reside and do not have access. So it is hoped that this would go a long way to addressing that deficit. However, I still see that Dr. John Toagbidi is still a little bit skeptical. But then there's a huge need in the rural areas. Let's hear you about what facilities are like in rural Nigeria.
You see, the lack of infrastructure constitutes one of the major bottlenecks in our healthcare delivery system, especially in the rural areas where they don't have easily accessible infrastructure in terms of transportation, in terms of communication. The roads are really bad. You cannot just reach them easily. However, maybe before we go into further details, well, it is a welcome development.
Yeah.
It is a welcome development. We just hope that moving forward we would get it right. And another thing you have to consider for the rural areas is that most health professionals, maybe because of the poor remuneration, they don't want to go to rural areas. You can go and put these facilities, but if you don't change the way things are done, in terms of management, in terms of training, in terms of care, the general welfare and motivation, those people that are supposed to be in the rural areas to administer, health care, services, they would not like to, go there. Because, tell me, you cannot just go to a rural area where you're supposed to have a basic laboratory that has to use, electricity, and maybe for a whole month, you don't even see electricity. How are you going to do that? It's just impossible. You look at parts of the world where these things are done properly. Even let's use an example of a small country like, Cuba. If you see that the health care standard in Cuba is just unbelievable. And in terms of development and natural resources, I can tell you that Nigeria is more blessed than, Cuba. But they're able to train their staff. In fact, in Cuba, when I had the opportunity to be there, they have a saying that in Cuba, the doctor doesn't come to see the patient doesn't go to see the doctor. That is the doctor that comes to see the patients. And a small country like that, that is why it was that. And let me share this experience. When we were in Cuba some years ago, one of our team members got sick. Now, we didn't know how the system operates. We were just kind of never say, oh, what are we going to do? What are we going to do? Honestly, the Cuban guy just laughed and told us that I said that in Cuba, the doctor comes to see. Within 10, 15 minutes, the doctor was there, attended to the person that was sick. Then the next thing was that, oh, how are we going to get the medication? He said, no problem. Before you could say, Jack Robinson, the pharmacist brought all the medications that were prescribed, sitting in one place. So the point I'm making here is that if we want to make things work, we should make it work. A key to healthcare delivery services is what we call the primary health care. For the primary health care centers, they should be a focus on this. And one of the primary health cares are not actually set up in urban areas or in cities. You center in the rural areas. And they should have infrastructure. The staff should be trained. The staff should be properly motivated so that they can go there to render the services.
Rural health facilities have for long been in a state of, there are so many Nigerians who tell you that almost non-existent before you even talk about the state of facilities in there. And so it is hoped that applying this funding would go to the grassroots and address some of those challenges. But again, let's spend some time talking about those basic health challenges that you find mostly in the rural areas and how to surmount them.
Just like Dr. Awide has just submitted, it all boils from the organized system at that level. If it is not well properly planned from the states and is spread to all the various divisions, you will not be able to have the results that is required. If you go to most of the rural areas now, the hospital buildings are dilapidated. All you get is very big contract for the supply of certain basic equipment that are lying scattered. You may enter with the ceilings falling down and not. Those are not encouraging for even people walking around there. They even feel ashamed sometimes to go and report. But you get huge contracts, bringing in items that can stay within a few, those items get either stolen or they develop legs and walk out of something. So the best bet is to use the WHO guideline, and as has been done like for countries like India, where now WHO is using India's data to do some of their projections, because they are intentionally do their health policy, do their health diagnostic, do their health tracking based on standard procedure. And they do it consistently. And we can do the same. We have well-trained people appointed as Minister of Health. But going down to the level of the states, they have relevant, well-trained people appointed. So it should be very easy to be able to appoint a health team at the various levels to see that these health facilities are well planned, in line with standard procedures, standard steps as given by WHO. Even at the rural level, WHO has planned such a thing.
All right, in addition to the discussion in the studio, we have a number of reports. Let's start off with this one from Lagos.
Lagos, a bustling state with over 20 million people, needs a robust health system to keep its population healthy. In addition to other health facilities, the state relies on more than 300 primary health care centers. Recently, government equipped the facilities with solar power sets and upgraded maternal wards, which residents applaud.
What the government has provided for us in terms of that equity sharing is even above the world standard. If they are to get the world standard, I'll give them above the world standard.
They just need to work more on the facilities. They are really trying a lot, and the doctors are good.
They are trying.
Even with the upgrade, the federal government is still working towards making the centers perform optimally with the approval of the disbursement of more than 32 billion naira to primary health care centers across the country. Medical experts describe the move as a strategic overhaul designed to standardize, equip, and sustain the facilities. The disbursement of the funds focuses on performance-based implementation, transparency, and accountability for procurement of essential drugs, consumables, and maintaining the facilities.
Whatever finance can solve to help the primary health center to do more of their functions, basic treatments, immunization, surveillance, registration of beds.
It's not just money. You must have a very solid plan. You must have a system of accountability. You must have very strong clinical governance.
For millions who rely on these clinics in Lagos, the hope is that the renewed Hope Agenda's intention of ensuring 1% of the Consolidated Revenue Fund is channeled into strengthening primary healthcare infrastructure will be achieved.
All right, that's a report from Lagos. Let's take this other one from Port Harcourt.
In what has been described as a significant boost to revamp Nigeria's health sector, the federal government's recent approval of the release of 32 billion naira through the Basic Health Care Provision Fund, targeting improved service delivery at the primary health care level, is timely and commendable. The intervention is geared towards changing the narrative at frontline health facilities and attending to the health needs of Nigerians with professional medical personnel and access to essential drugs, which sometimes strain service delivery, especially in rural and underserved communities. Public health analysts stress that beyond funding, community engagement is essential for sustainability and to drive long-term improvements. They also advocate for coordination between federal, state, and local governments to maximize the impact of this intervention.
As a sole employer of labor, as you are paying, bringing drug, paying the staff, paying the workers, supplying the drugs, servicing the facility, optimally managing the whole areas and the health policies, you will get a good result. And there will be turnaround reports, positive information going back to what? As a feedback to federal government. And there should be what? A monitoring team for what you call primary domiciling, implementing structure that will make a primary health care facility within the remote areas feed impact of this federal government laudable measure.
Because now at this point, the government through the provision have made available affordable drugs, then it will also reduce the out-of-pocket spending on medical tourism by the people. And if this is done, you will now discover that what they have will be imputed into nutrition, which is a backup method for the drug administration.
There are also calls for sensitization to ensure that citizens are aware of the services available to them under the program, thereby increasing utilization and improving health outcomes.
So if this money comes down, it trickles down to where it's supposed to be, to the target organ. Definitely, it will do what the federal government is planning to achieve. So it's a very good venture, so that our drugs can be available. The same drugs must be affordable, because there are places where drugs are available but they are not affordable, right? And we're talking about safe quality drugs that can trickle down to the primary healthcare center.
With this renewed investment, expectations are high that Nigeria's primary health care system will witness measurable improvements, bringing the country closer to achieving its universal health coverage goals.
Well, back here in the studio, you would see that from those reports, commendations, yes, it's the way to go. But the same issues which you have raised here have been raised by many of the respondents in those two reports. And that is, it doesn't begin and end with the amount of funding that goes in, and it takes a lot of planning. And of course, there are various aspects of it, not the least accountability. So even though the people are commending the government for this intervention, they are still pressing to ensure that it is carried out after thorough and meticulous planning to ensure that the funds go to where they have been deployed. And another aspect which we got from the very last report was the question of sensitization. Are the people aware that what would benefit them and reduce their out-of-pocket expenses is been done?
This is a major issue.
Yes, Dr. Agwidi.
Well, let's commend, the federal government for the 32 billion that has been released, just like we've all agreed, and I'm happy the people from, the reports that we also got, they need to be aware that these funds have been released. And not only the awareness, the key word here is accountability, accountability, accountability. This has been our main problem. There is no accountability. People would do things at the punitive level. We need sensitization and accountability. I cannot agree with that anymore. So we've heard of such, events, but today, where? So in other words, what I'm calling for is accountability and sustainability. It's not just right to just release that, and they should be planning, monitoring, and sensitization. This money is released. For what amount of period? Then after some time, there should be a key performance index that must be actually evaluated. How well have we done in implementing this, project? You score yourself. Areas of improvement that needs to be improved must be improved. Proper accountability should be given, and we should also see results. It's not just enough you did this maybe just after 1 year or 2 years. Is it going to be sustainable?
Speaking of which, in your opening comments, Professor Benamodu, you talked about certain facilities that go without much needed infrastructure. You spoke about rural centers with little or no access to electricity. But from the first report we carried, which was from Lagos, we did see how part of this revamping of the health centers, we saw solar panels being deployed in order to provide all-around electricity. But it takes us back to what yes, about sustainability. Yes, we have the panels in place. The panels also have other inputs, batteries and all those, and they run for a period of time. And again, there's a matter of making sure that these facilities are maintained and are sustainable as to provide electricity to those centers, which of course you had drawn attention to has been key to improving the status of the health facilities, particularly in the rural areas.
Yeah, I think the government should be commended for this volume of releases for the rural improvements in the health facilities. And based on this issue of accountability we've been talking about, I think there is a need for a kind of set of committee in terms of monitoring and evaluation to be formed, to oversee, to see that what has been released is actually released to all the units that are expected to benefit from it, and to see that the releases are made in good time to allow for procurement planning. You know, there's a need for needs assessment for the procurement of these goods and services for those areas. And there's a need for, maybe at the presidency level, for a monitoring team to go around to see that what has been released has actually been used for the purpose for which it is released. So that issues of sustainability, issues of monitoring to see that these things are done accordingly, so that some people are not within the system taking advantage of all these things. From the report we had, Lagos is doing very well. Solar panel and everything have been seen. We would have preferred even states like Kogi State to come up, Benue State, and all the other states, so that we see what facilities are there on ground. That's right. Based on these releases that have been made. So that you don't just take a few areas that are doing very well, relax, and you are not achieving the purpose for which...
Let's spend some time talking about some key issues, particularly in the rural areas, health issues. One of them, maternal and child health. The other is the matter of disease control. And as was mentioned in one of the reports, drugs that are safe, available, and also affordable. But let's begin with the matter of maternal and child health outcomes, Dr. Agbidi, particularly in the rural areas. Are we seeing a reduction in the mortality rates that we have been so associated with for so long? And what are those missing things? What aren't we doing right to bring down maternal mortality?
Well, Sri, what I'm going to tell you is this. Generally, there is an increase in the disease burden. And this comes from both communicable and non-communicable diseases. Let's look at the communicable diseases. If you go now, epidemiologically, we've seen that cases of diabetes and hypertension are on the rise.
Why is this?
Why? Good question. Well, the whole thing about disease is linked to, lifestyle. the lifestyle in rural areas is changing. There is need for people to be properly, educated. And one of the best ways to do this is through these primary health care centers, both in terms of provision of materials as well as education. And I think this is the crux of this discussion. That's why we are here. These things are lacking. And if you don't have the primary healthcare centers functioning properly, Rosamari just described it, most of the primary healthcare centers are in a dilapidated state. So why wouldn't the disease rise? There is no checks and balance. The place that is supposed, it's just like, I like talking and giving an example. You suppose when you are sick, you go to a doctor, the doctor treats you, and you get well. Now when you're sick, you go, there is no doctor, or a doctor who doesn't know how to treat. I'm not saying that doctors don't know what they're doing. No, I'm not saying this. But I'm just giving an analogy that if they are not there, what are you going to do? From one complication, you go to the next. And when we describe healthcare in general, it's actually a chain. If there is that break in that chain,
it's a failure.
You cannot deliver the results. Talk about infrastructure. If it is not there, the chain is, broken. You talk about trained personnel. If it is not there, it will not work. Then if you talk about monitoring and surveillance, checks and balances, accountability, if it is not there, the chain is, broken. So all this must be put the puzzle together so that there will be no break in this chain. You cannot, great. And so as we've all appreciated the federal government's efforts for giving out such money, 22 billion, great. But these facets of the chains must not break. There should be proper infrastructure, we'll look at it, trained manpower, then implementation, and make sure that the people get the right, drugs and the right education. It is part of what we are doing now. So if they are not properly educated as to know well how to handle their lifestyle, the disease will keep rising, as it is the case. Because the environment or the lifestyle is, changing. You need to go to rural areas and see cases of, diabetes. It was not the report in some years past. Everything is on the rise. Unfortunately, some of the communicable diseases, they're all coming back. Things like tuberculosis that we had thought, we had said goodbye to. Those things are coming back in the rural areas. Cases of, malaria, they're back on the rise because of poor maintenance of the environment that promotes breeding of, the vectors.
Mosquitoes.
Mosquitoes that, transmit, the disease. So you can see, if you just talking here, maybe providing money, and the money drops somewhere on the way in the hole, it doesn't go to control those mosquitoes, you see, you're not solving your problem. And if you're not training the staff and giving the proper motivation to go and work in the rural areas, there's a break in the chain. Let me stop here for a while.
No. All right. We'll take a short break here. When we return, there'll be more on this conversation.
A network issue-oriented innovation talk show.
revamping some 5,000 health facilities across the country, particularly in the rural areas. And this would be through the fund, a 32+ billion naira fund, which is being disbursed to enhance healthcare delivery service. Just before the break, we're listening to Dr. John Toagbidie, and on the heels of that, let's turn to Professor Ben Amodu, who also has an input in those key areas we spoke about earlier: maternal and child health, disease control, and safe, available, and affordable drugs.
Well, communicable and non-communicable diseases have been a major plank of my research. And according to the submission by Doctor, the non-communicable diseases continues to increase. And that's the worries of WHO. As of this period, this year, 74% the cause of death in the entire world is due to non-communicable diseases. And which are the diseases are we talking about? Diabetes, cancer, stroke, chronic kidney disease, hypertension, ulcer, sickle cell, and so on and so on. These are the gamut of diseases referred to as non-communicable. And each year, it was 61% the cause of death before. This year is 74%, and it continues to progressively increasing. So diabetes now is affecting over 500 million people worldwide. And we are talking of maternal issues. How do women get diabetes? How do women get hypertension? From child delivery. Any mother that is going into delivery develops hypertension and diabetes. Sometimes it stays briefly, goes away on its own. Sometimes it will refuse to go. And subsequently it becomes a problem, even from the contraceptives they are using. And now that the cost of drugs are so high, those things, are they coming? So you need to do this planning. That's why we're talking about these 32 billion, big money. Before you do your needs assessment, you plan procurement, release of funds, and all that. Some may not even utilize the funds. So they need to have a proper strategy to plan this procurement and monitor it and do evaluation so that at the end of the year, you would have known, oh, this 32 billion based on so area for so number of clinics or whatever they call them all over Nigeria. How have we been able to do with this 32 billion? So that for sustainability and way forward, we would have learned from what has been spent and what has been released and the level of performances. You may be in a rural clinic. A woman who is trying to deliver has an issue, and the issue cannot be handled within that locality. There's a need to make phone calls. There's a need to use a vehicle to, there's no petrol. The vehicle is available. The tire is down. So many things. So this thing has to be carefully planned and done so that we can achieve. Cardiovascular disease accounts for 17.9 million deaths. And these are things that can be controlled. What are the gamuts of cardiovascular diseases? Hypertension, cholesterol issues, heart-related issues, and go. And these are things that can be carefully, from his perspective and my perspective, these are things you can control quietly using some cheaper methods and so on, without depending on statins. You have to buy statin to take to clear cholesterol and all that. In my Nigerian situation, in over 15 years now, we've been curing an enlarged heart without the need for a complicated open heart surgery. I was reading on the social media that an enzyme has just been discovered now in Italy that can dissolve cholesterol and thereby reduce the clogging of arteries by lipids, cholesterol, and what have you. This is what I have been doing in the last 15 years without operation. You know, once you are 50 years and above, to open your heart and do operation for over 18 hours, a lot of people will pack up on the operating table. So we need to integrate the various aspects of healthcare into the general, for proper management and for cheap management and so on, because we do this at a cheaper rate.
All right. We'll come to that shortly. But let's return to one or two other reports that we have here. This one is from Kaduna.
Established under the National Health Act of 2014, the Basic Health Care Provision Fund provides a basic minimum package of health services to Nigerians through primary health care facilities. The fund is sourced from the federal government's consolidated revenue, alongside support from development partners and donor agencies. Through its implementation structure, the intervention operates across key gateways, with 45% allocated directly to primary health care centers, 5% to emergency medical services and ambulance system, while other portions support public health emergencies and essential health interventions.
The primary health care gateway, the insurance gateway, the Center for Disease Control gateway, and also for the emergency medical services gateway. So that is how it is distributed.
Money the national sent and what the facility have, the rule of the state is that 50% of that fund on a quarterly basis must be used to purchase drug at the facility level.
In Kaduna State, the fund is being utilized, translating into improved service delivery, with 255 primary health centers renovated and upgraded to level 2 standard, becoming more functional, accessible, and responsive to the needs of the people, even in rural communities.
There is a governing structure that monitor how this fund is being implemented in the state. Federal level, we call it the Ministerial Oversight Committee, while at the state level, we call it the State Oversight Committee for the Basic Healthcare Provision Fund.
Well, we have areas of tracking accountability in the state. One, that is the first and foremost, is the issue of fund retirement that we only send to the national. We have other NGOs like civil society organizations that help us to track implementation of this activity at our various facilities.
So what we have seen actually over notably the past 3 years, onset of this year 2026, we have seen about 27% reduction in maternal mortality in the state. We've seen about 30% reduction in childhood mortality rate. Childhood meaning under 5, neonatal and infant mortality, in addition to some other output achievements in utilization of modern contraceptives.
However, stakeholders are calling for increased transparency and accountability, especially at the local government levels, to ensure that the resources are utilized efficiently and reach the intended beneficiaries.
All right. From Kaduna, we go to Enugu for another report.
In Enugu State, the funds are expected to enhance healthcare access and quality, especially for the vulnerable population. The state has already taken steps to enhance healthcare initiatives like the maternal and neonatal mortality reduction, innovation initiative, integrating primary health care, insurance platforms, and emergency response systems to make communities active stakeholders in the process. Other initiatives include recruitment of 450 health workers and construction of 260 primary health care centers across the state.
From that area, we try to enhance service delivery at the primary care level in all our wards. One primary health care has been selected in every ward, and it's called Basic Healthcare Provision Fund Primary Health Care, where this program is implemented. And each quarter, a quarter is 3 months, this funding support comes initially it was about 300,000 in the quarter. Now some primary care center is getting up to 600,000 in the quarter to help it to be able to buy drugs, get support and midwives and other people to support care there. In some primary care centers, if in the old ones you notice there is a leaking roof or they don't have water tank, they can use these funds and buy it and support healthcare delivery there. But the good thing in Enugu State is that apart from those kind of things, we are also on our own as a state building type 2 primary care centers that are state of art. So that is also some other thing that's happening at the state to complement the effort of the federal government.
Basically, the disbursement of the fund will tackle maternal and child health, emergency services, and routine immunization by expanding coverage areas. The National Primary Healthcare Development Agency is working with the Enugu State government to revitalize primary healthcare centers and facilities.
We are recording in thousands the number of babies that have been born. We have indeed lost count. And these are babies that perhaps would not have been able to have the opportunity to see the tomorrow.
The Enugu State government is working with development partners to ensure effective utilization of the funds, promoting a statewide approach to unify planning and monitoring processes across the healthcare sector.
All right, just before we get to those two reports, just a quick reminder that the phone lines are now open, and it means you can join in the conversation in the studio. If you're calling in, we say this every Tuesday, you're calling in when your call gets through. If your call gets through to the studio, turn down the volume of your TV set. That's the way to avoid the echo or the hurlback. We also like to encourage you to go straight to the point, ask your question or make a comment, and our guests would respond to such issues as you might raise. We ask that you do not bother too much about the greetings, just a simple hello would do. And so we expect to hear so much from you, contributing to this talk about improving and enhancing healthcare delivery service at the rural areas through this 32.88, I believe, billion naira fund, which the government is providing. Yes, back to the discussion. We see the example of Kaduna State, for instance, and perhaps 50% of whatever allocation they're getting
the government
is going to the purchase of drugs, and the state government also is chipping its own in. And you do find that happening. Well, it might not be the same model in all the states. However, the matter of accountability has been pushed forward, where there is actually a state oversight committee which works in tandem with the ministerial oversight committee. Perhaps those would help to allay the fears which you gentlemen have expressed about accountability in handling of this fund, sir.
Yeah. That is part of what we are talking about. So the example being exhibited by Kaduna is commendable.
Yeah.
And it should be others who are not doing the same should learn to do such, so that they know that there's an oversight. Knowing that there's even that committee alone will go a long way to prevent a number of issues that we have raised here.
In your comments just before we took those reports, you touched on a key aspect of healthcare and said, while all this is going on, there has to be an intentional effort to integrate medicine. And that takes me to Dr. John Toagbidie. You are an integrative medicine specialist. Let's talk about that. What does it entail? What is it?
Sri, you've really touched on my heart a bit, and I'm going to respond. You see, let me take this opportunity to espouse what integrative medicine actually means. WHO, that is the World Health Organization.
Okay. Well, if I might just ask you to hold on a while, as we get in the very first phone call, coming from Ahmed Lawal is calling in. Ahmed is calling in from Jigawa State. Hello. Hello. Yes, go right ahead.
I just want to contribute.
Okay.
Yes, I just want to talk about the implementation. If it will be implemented, I'm sure it will go a long way in solving a lot of health problems in the country.
All right. Okay. All right. Okay. Your concern is about implementation, and which is what guests in the studio have also been harping on. If it is properly implemented, then it will go a long way to solving the many health challenges in the rural areas. Thank you for calling in. Yes, Dr. Agbidi, if you can just go.
Let me go straight to the point. Integrative medicine, you've asked me that what is this all about? Basically, WHO has recognized three aspects of, healthcare delivery that we can assess ourselves to. The modern traditional medicine, you talk about, the orthodox medicine and what we call complementary medicine. And in looking at things, we're all saying that indices of both communicable and non-communicable diseases are on the rise. And the question, why is it so, is because of our lifestyle and then other factors. So what WHO is saying that because of the complex nature of how disease has actually evolved, maybe some 20 or 30 years ago, I wouldn't be concerned of dying from, cancer as I would be today, because environment has changed and things like that. And cancer, for example, is very, very complex, multifactorial, multi-systemic, failure of the body organs. So it needs a multi-functional approach.
Okay.
So that is when you say you are integrating, you are looking at the modern traditional aspect, you're looking at complementary aspect and orthodox aspect, so that you can drive your head, better.
Right. We'll return to that in a moment. Let's try and get this call through. Reverend Chris from Jos. Hello.
Hello?
Yes, go ahead. If that's Reverend Chris from Jos, go ahead.
Yeah. Hello, good evening.
Good evening.
Yeah, I'm very happy with the discussion that is ongoing. I'm very happy with the discussion that is ongoing now. By the virtue of my position, I'm the chairman coalition of civil society organization on health, Plateau State. By that, I happen to be a member of the State Oversight Committee. The challenge I have with the Basic Healthcare Provision Fund is, let me begin by saying I applaud the effort of the federal government in taking healthcare down to the grassroots. This is highly commendable. As civil society organizations, however, we think the intervention needs to be strengthened further by most of the state oversight committees are just there by name. The oversight is not performed at all at the various centers. The gateways receive this funding, they plan their programs, they claim they implement. Quarterly meeting, it's not enough to really ensure that the people get value the value for this money gets down to the grassroots. There must be deliberate oversight to these facilities, which is lacking. I think there should be a design from the National Primary Health Care Board or from the Disbursement Center where CSOs will be directly engaged to provide a separate oversight to the functionality of the Basic Healthcare Provision Fund. By that, we are going to achieve the intention or the plan by bringing this service, which is accessible by our people. I've gone around to supervise at some point the enrollment of the indigent people at the facilities. Sometimes the wrong people are enrolled. You don't get the right people to get the services. We know the retirees are there, the pregnant women, the children under 5, and the poor of the poorest. But you go there, you see different people accessing health care. So I would call that there should be a deliberate plan to fund CSOs to monitor the process in the various states at the facility levels. Thank you so much. I appreciate it.
Thank you very much, Reverend Chris. You've just raised some very salient points here, and this was the concern at the beginning of this discussion, and here it is playing out. Yes, you have a ministerial oversight committee and you have state oversight committees, but again, this goes back to the traditional challenges we have in committees functioning the way they ought to. You heard the man say that many of these state oversight committees are not doing any oversight at all. Yeah. And these are the things that are likely, that would likely disrupt the successful implementation of this project. And he is calling for more civil society organization involvement in oversight functions. So,
yeah, I think it's still the same thing we've been talking about. There's a need for government to listen to these suggestions and implement them so that for the better results and for better utilization of the good gesture of government giving this amount of money for the entire system of the country. And doctors spoke about sustainability and all that. If all the committees are in place and they are bringing very standard report, it will be based on that report now. We will now say this thing for this year, how did it perform? And then areas of conflicts or areas of low performance are identified and corrected for sustainability so that in the next disbursement, a lot of the loopholes can be blocked and then things strengthen out and the intentions of the scheme can be realized.
Right. Let's return to the phones. I think there's a Jalingo on the line from Abuja. Do we have him?
Hello?
Right. Hello.
Good evening, Mr. Singh, my father.
Good evening.
I just want to greet the other people that they are invited on the floor. My only just a question. The question goes to the professor directly. He has talked about the issues of diseases, but my question is this: how do we control all these things? Because some of the issues that he raised, mostly about the hypertension and the diabetes, that's the only sickness that almost kills many people in this country now, because of the hardship and the issue of family in the house. But how do we control it? Are we going to control it within ourselves or we should?
Okay. Well, easily he's referring to the scary figures of the incidences of hypertension and diabetes, which you talked about, and he's wondering how do we control this?
Yes, that is why you talk to the doctor about the integrative nature of all these things. Yeah. If we are all involved, talking together and providing solutions, For diabetics and co, there are a number of lifestyle
modifications.
There are a number of things that can be through education, which you have suggested earlier and all that. If we're all involved, coming together.
Easily, when you say lifestyle modifications, well, what is it that people are doing so much that, you know, exposes them to diabetes?
Yes,
and
yes. I can give a few before Doctor speaks. You know, weight, our weight, a little change in weight, WHO is very, very serious about it. Your weight as human beings, any little change can lead to any of these, if you don't have the right BMI, weight over height squared, the square root of it must be less than 25. And for men and women, it varies.
Okay, so you know, those traditional
if you are
things,
not overeating,
you begin to put on weight, and they say, well, that's a sign of good living.
No, it's bad living.
Right.
So once you have this education, once the healthcare system is well organized, and the proper team is well maintained, if you have a proper team maintained, that includes all the health professionals and everybody contributing as it should be, and there's no discrimination as to this group is more than that group and so on, it's well represented. In this type of lecture, people can be told,
Well, Doctor, you talked about lifestyle changes, and there are lots of people who tell you the kinds of things they eat and the diet and all that. But again, others will say to you, listen, these are very difficult times, and people are just struggling to at least have something, and they're not going through all that rigors of ensuring that what they eat, they just want a full stomach. And you talk about lifestyle changes and diet. Okay, let's take this call from Ominis from Lokoja, and then we'll return to that. Hello, go ahead. Ominis from Lokoja, if you're there.
Yes, good evening. My name is Abdullah from Lokoja.
Yes, go on.
I've been following the trend and the issue of health system in Nigeria, looking at the amount that is being displayed. The amount may look bogus, but issue of healthcare financing is much more beyond just figures. There is a fundamental problem in the health system in Nigeria in which people don't understand the difference between economics and health economics. A single health problem can consume this 32 billion that we are seeing as a big fund. So if you look at the model of the WHO, we say that there are 6 or 7 pillars, but that the central pillar is human resources. You can bring billions into the health system and the system will swallow it. Example, how much is an MRI? It's over $1 billion. But if you look at it, the basic health needs of Nigerians are health education, health promotion, health information. Most of us are lacking this. Go to our university, we do GMS, general sciences. People don't even know how to prevent common malaria, common infectious disease, common basic things. These are where the problem starts from. If you go to a highly educated person, even to the status of a professor, PhD holder, if you ask them what are the preventive measures of common diseases, they don't know. And if you look at it, prevention is better and far, far cheaper than a cure. So we need to start from the primary schools, the secondary school, and we graduate up. It's not just about saying it. It's about doing it. And if you look at what the gentlemen in the studio are here for, we need to also integrate our own local health system, our hubs, because if you look at the Indian system now, anything related to gastrointestinal, that's GI, they mostly focus on their traditional approach. They did not say that the modern medicine is good, but it is too expensive because it is dependent on the petrodollar economic. So we need to come to home what is health economics in relation to our local available resources, which is what primary healthcare focuses on. This approach through basic healthcare is excellent, but with our system, it is not sustainable. So we need to look at ways to sustain the system locally. Thank you.
Thank you very much. Well, gentlemen, you heard the man.
Yes. Well, Sri, just before went into that, you had asked what does lifestyle really mean. I think it would be most appropriate for us to get this explained to the public or to the viewers. You see, when you talk about lifestyle, lifestyle is all encompassing, and I will look at specific indices. Take, for example, simple rest. If you're not resting very well, you are exposing yourself to, disease.
How do people rest when they are struggling to make ends meet in a depressed economy?
Well, let me use the words of Bishop Yedipe to really encourage us, that if you don't learn and accept to rest, people will lay you to rest. Yes. So now it becomes a question of a balance, and that's why education is really key. Yes, in the face of all these challenges, hard lives, this and that, if I knew that rest is very important to my own health, I would try to, balance so that I can scale through. Now, rest also means sleeping well. Syria, I'm going to tell you, 60% of all diseases, including diabetes and hypertension, they are linked to sleep deprivation or inadequate sleep. We've talked about this before. There is the right time to go to bed. We have disobeyed that time now. We should have all been asleep. But just once in Tuesday, Tuesday, it's not. What I'm talking is when it becomes a perpetuated, habitual thing that you are engaged in. Every day you are sleeping after 10 p.m., 10 p.m. If you continue like that over time, you will get into trouble.
And sir, just to chip in for our viewers to learn from this. If you, as an adult, you start waking up 2-3 times every day, BP.
Yeah.
I ask people that come to my clinic, apart from what you have complained, how many times do you wake up in the night? Oh, pharmacist, 3, 4, 5 times. I say, there's a problem. You have an enlarged prostate. And from there, your BP will be climbing up because of the sleep rem you are disturbing. Every now and then you are waking up to, your BP will be going up. So anywhere anybody is listening to this program, once you are waking up 3 to 4 times, you are likely to have a prostate enlargement. Go and do your test in the lab tomorrow. You will call Cyril to tell him that based on your program today, you did this, and this is the result you got. And we can give simple mixtures that once you take it 2-3 days, the waking up goes to 0.
Yeah, if I may just chip in a little bit, we may not get as complicated as that, but simple lifestyle, this thing, drinking maybe 2 or 3 bottles of water before you go to bed after 7
Very
o'clock
critical.
can also make you to wake up frequent urination. So in addition to what he has said. So this is lifestyle. Then when you talk about, diet, it is really very important. The whole thing about us living is the cell is a unit of cell. You need vitamins and minerals for the cell to work very well. Then other things like, we've already talked about sleep. Even fasting. Fasting is really good for us. So these are the...
It's medicinal.
Medicinal. These are some of the lifestyle changes that you embark on your way to this. And when you talk about complementary medicine, we have what we call functional modalities. There are some of these things we use, like ozone therapy, which is not very well known in conventional medicine. Today, in fact, in Germany, they've done studies to show that if you implement ozone therapy in a place or a country, that country can cut its own health budget by almost 40%. Ozone is what? Simple oxygen. Our body needs oxygen so that the body can make energy for the cell to function. The cell is the unit of life. Disease is nothing but decreased ability of the body cells to utilize oxygen to make energy for the cell to function properly. Disease simply means the cell is no longer at ease. It is disease.
If we refer to our very last caller, he made certain points here and said that integration.
Yeah.
And the question would be, why are we not working assiduously towards that? If other countries have realized how important, I do know that there are efforts going on, but Nigerians would say, look, we need this to be happening like 2 days ago.
Yes, you're right. If you look at the whole world, especially in India, China, and even in the United States. America now. You have, they have integrated, and I told you that WHO has called for integration because the body is so complex. You have 9 organs. And this work in a very complex one. Gone are the days where you are just looking at the heart and you are focused on the heart as a cardiologist. The problem may not even be that it may be due to wrong lifestyle that has actually led to that.
Yes.
So we now talk about that integrative medicine means encompassing all these aspects of medicine that I've mentioned with a holistic approach. And integrative medicine lays a lot of emphasis on what the last caller said, prevention. And we said that prevention is better than So using integrative approaches, you're able to really, you can take ozone just for, prevention of, disease. You don't have to get to that point. As I always say, disease is a process. And you move from health to this disease, there's a wide spectrum. The only thing uniting that spectrum is the lifestyle. That is what makes you, once you start from, head, wrong lifestyle makes the tip, and you start going to that tip down to, disease.
Again, the matter of proper planning was not lost on the last caller, as he also talked about, yes, 32 billion plus can seem huge. But even one challenge can swallow all of that up.
He's correct.
That's true. Right. He is. And some of these things we need to follow through to. I remember I was in this very studio during COVID, where we heard that they were going to come up with centers in the 6 geopolitical zones, the centers of excellence. We've come how many years now? Have those centers ever come up? We should follow through with this, and it's just not saying it.
Well, for my colleague talking about COVID, I want to come in. And the need for integration. When COVID came, actually I wrote a letter to a serving minister that I'm researching in the specific area of communicable and non-communicable diseases. And COVID falls in one of the areas. We have dealt with HIV/AIDS, a virus. COVID is a virus. What we are doing can help. What happened? They didn't reply me. No. I have to take my preparation to JOS, which is a viral center, and they analyzed it and said, yeah, you have a point. These things are reactive. Then the minister said, come and see. 4 committees were set up. And the committees all recommended what we are doing. But the most important thing is that we deviated. We went to a small island in Madagascar and took their own that has not gone anywhere for the treatment of the COVID. But eventually, we cured COVID on the social media. Those we treated got cured, and they went there to say, we are cured. And then the government announced that what they bought was not fit for human consumption. So let us try to believe in our own. Nobody has 10 heads. We're all doing science.
Okay. Well, now let's come to another aspect of this disbursement. It's a key matter which you've raised. And of course, our last caller did say the way the system is now, it is not sustainable. And if it is not sustainable, then the purpose, it's not fit for purpose. The purpose is defeated. So how can these interventions be made to be sustainable so that we do not end up in a situation where, yes, the funds are provided from the basic healthcare provision fund, they go in, and because of the system in place, after a while, this becomes no longer sustainable and becomes abandoned. Like so many other things have happened to this country. What should we? Okay, let's take this call first, and then we'll return to that. Dr. Garba calling in from Jos. Hello. Yes, Dr. Garba, if you're there with us.
Yes, thank you so much, Cyril. Can you hear me?
Yes, we can.
Can you hear me?
Yes. Yes, go ahead.
Thank you so much, Cyril, for this opportunity. I have always admired your professional anchor since my university days 30 years ago. First of all, I congratulate Nigerians for the 32 billion disbursed for the health sector. I don't know whether we can start dancing with that, because I know we are all aware of the cash bucket problem in our budgeting system. I don't know whether this money is really coming in. Yeah, that said, Professor Ben has rightly pointed out some problems that we encounter in implementing our policies, even if the money is there. For instance, the absence of infrastructure, and the issue of monitoring and evaluation, and then accountability frameworks that usually are absent. But Professor Ben has not said anything as to how to go around these problems. Whether Prof could go ahead and advise as to how to go about them, because these are problems that we always face in policy implementation in this country, even if the money is there. Thank you so much. Bye.
Right. Thank you very much. Well, yes, the problems have been identified, and we're still in the process of proffering one or two ways out of it to ensure that this doesn't end up like so many projects in the past. Yes, we would see from the outline a lot has been set out. We did talk about the setting up of the ministerial monitoring, committees, as well as the state oversight committees.
Monitoring and evaluation.
Monitoring and evaluating how the project has been implemented. Now, we've had some reports speak about the oversight functions, progressing thoroughly, but we've also heard about how some state oversight committees are not working. And so there would be need to assess on a general basis, we're talking about all the states, how far this is meant to improve the healthcare service delivery in mostly the rural areas. Now, if the state oversight committees are not functioning the way they should, then of course the benefits would not be derived in this project. And so our last caller, Dr. Garba from Jos, has said, well, we have identified the problems. What's the next stage? What's the solution? How do we go about them?
Sorry, I would like to I think it's just to gather all what we are discussing here for government to sit down now and implement them. so as to correct them, so that it will not just be plunging the money into the system and in our usual way, the money disappears. At the end of the day, what it's supposed to do, the benefits we're supposed to get, we're not getting it.
Well, if I may add, Sri, we have a common balance that there is no need reinventing the wheel. From the report I've heard about from, Kaduna State, it looks like they're doing a good job.
Yes.
Why don't we use their own
standard
model?
Yes.
You just implement that rather than trying to reinvent the wheel, and sometimes you may invent something, not a wheel.
Yes.
But go to where it is happening and there is documentation and success. Implement what they're doing. This is what I would say.
With the oversight committees in the states, the caller who drew attention to that suggested that at the national level, there should be more involvement of civil service organizations and that the whole system needs to be strengthened. Now, beyond implementing these, how about some suggestions have been made? How about ensuring that where those oversight committees are not performing well, the states would take measures to either replace those committees, or if the committees had been found to have in any way impeded the smooth implementation of the entire process, then sanctions. Because all the time we say people do things in this country and there are no sanctions, and therefore they get away with anything and the cycle continues.
Well, you see, there is this saying that an easy lies ahead that wears the crown. Honestly, that's why when you go to the state, things are going right. Who is the first person to be praised? Is the governor and his executive, committee. So, I would say specifically that all state governors, they meet and interact with themselves. The governors should find out from Kaduna State, how are you able to do it? And you are doing it right. And they should go in their own state and lay that foundation where there is monitoring, implementation, and reporting. But anything short of this, we're just playing, the old tricks. It will not take us anywhere. So the state governors, under his own dedicated officer, that is the state commissioner, who is in charge of it, they should take it as their direct responsibility and make sure that it is done right, without compromising, standards and their reputations.
Well, someone also raised the issue of other matters with regard to the disbursement of funds. Well, we are not in a position now to know if those would be, if those would affect this particular initiative or not. The question of cashback is something that's been...
It does.
Yeah, well,
it does, because it's a standard procedure for procurement issues. The procurement has a standard, they need for need assessment and all those things. There are procurement processes that must be passed before anything is done. So it will affect it, because I have worked and I retired as director of procurement in about 13 ministries. So I know that procurement is a big issue. And in most of the units, the people are not properly trained in this area of procurement. And this creates a lot of problem in fund disbursement, to the extent that at the end of the year, you find so many funds not dispensed as a result of lack of knowledge, proper knowledge in procurement planning and execution.
And also, Sri, there is another component of this that I would like to add. You see, what is wrong with the system is what they normally say. Maybe you put in square this in
wrong people
places,
in
wrong places.
Position.
If we want to do it right, there are people.
The right people should be placed.
Yes, the right people should be placed. And society knows these people, and the government has records of people that can perform. But unfortunately, the spirit of favoritism or whatever comes in. You have the wrong people in places that they are not performing, and I think this.
It's a major issue.
It's a major issue. No more credit, or credence. People are just given either because of favoritism or maybe party affiliations, which I'm not calling against. Yeah, they should, but they should be the right people that can perform. You put them there.
All right. Let's quickly take this call from Nelson. Nelson is calling from Delta, I suppose. We're right about that. Nelson from Delta, hello.
Hello.
Hello, yes.
Yes, good morning.
Well, it's all right. Just go ahead. Yes.
Yes, good morning.
Okay, go ahead.
In fact, I appreciate your conversation. I appreciate your conversation. Your conversation.
Thank you.
But really what I want to contribute is how the money is being spent that matters. Those ministers that allocated that money to, they will sat on it, share it with themselves without using it judiciously.
Well, Nelson, you're so pessimistic. Is Nelson still on the line? All right. Well, from the little you chipped in, it would seem that Nelson is so pessimistic that all the officials. Okay.
But
okay. Let's take this call from one of the regular callers, Ada from Jos. Hello.
Hello.
Yes.
Yes.
Are you also that pessimistic?
Calling from Jos Plateau State.
All right, go ahead.
Very interesting conversation.
Mm-hmm.
When you hear the amount, can you hear me?
Yes, we can. Go ahead.
Hello.
Go ahead. We can hear you.
Yes, sir. Okay. When you hear the amount, 32 point whatever billion, one will start, trying to clap hands. For me, I'm not excited. Mm-hmm. That money is a drop in the ocean, if you ask me. Even if it doesn't go to any private pocket. Truth must be told. If we want to address the issue of healthcare, in Nigeria, it must be treated holistically. That is why most times, those that they have, you don't find any of the relations patronizing them. What of the Japan syndrome? You go to most of these healthcare facilities, especially in the rural areas, you cannot find a doctor there. You can't find one. Even nurses. It's just when you have one or two states doing the right thing. It's just, it's not something the equip or the primary health centers equip. If it is addressed holistically, a healthcare facility, even at the primary level, should have a qualified nurse. Sometimes what you find there is what they call a lizard nurse. I guess, I don't know if you have ever heard of a lizard nurse. A lizard nurse is the one that they are not qualified. These are the ones you find there. That's why we have the mortality rate is so high. There's so much pressure on the secondary and tertiary level because those the primary health centers cannot do what they're supposed to do. I'm talking about let's remove even corruption. So let's be really fair. on the way we handle issues in this country. All the same, let's not give a Nigerian guys in mind.
All right, thank you very much, Ada from Jos. And we have these two opinions now. First was Nelson from Delta, who was so pessimistic, and he felt that money was going to go down the wrong way. Well, Ada seems to think differently, that even if it doesn't go down the wrong way, there's a big question of well-trained personnel, which you talked about earlier on, that many of the healthcare facilities lack qualified health practitioners. And of course, the whole thing is compounded by the so-called Japa syndrome.
Yes.
And you had mentioned earlier that there was need for adequate remuneration for health practitioners and an improvement in their conditions of service, which is the only reason why they would elect to stay back or be deployed to the rural areas and not elect to be in the urban centers. So how far can this go?
Well, to answer your question, it will not take us far, and that's why we are where we are today. Apparently, I was talking to a friend of mine who retired as a very senior consultant, and he was telling me as a consultant, he wasn't making more than maybe 900,000 or up to $1 million in a month. Let's draw back. They say that you have to find the cause of, in fact, educationist says that the moment you know the cause of a problem, then the solution is at hand. We talk about the Japa syndrome. Why are people living? They're living because elsewhere
better paid.
They're better paid. So I feel that healthcare professionals should be properly enumerated.
Okay.
To give them the incentives, especially those in rural areas. Nobody would like to go there and get stuck.
We have another caller from Delta, Mary, calling in from Delta. Mary, hello. Let's hope you're not as pessimistic as Nelson, who called from Delta. Hello, go ahead.
Hello.
Go ahead.
Good morning.
Go ahead. Right, go ahead.
Go ahead.
Well, we lost that call. Well, Mary, if you can, do try to call back in, and let's hear your contribution to what we're discussing tonight, which is the disbursement of billions to enhance health delivery service, particularly in the rural areas, and how it should go, and how to make it sustainable, and how to ensure accountability, that the funds go for what exactly they were meant to do.
And I think with what Doctor has said, there will be a need to do a special service scheme and remuneration for medical officers that may be posted to such facilities. And there's a need to even train more and more because of the Japa syndrome. Yeah. If we have surplus and we have very good remuneration, it is likely that people will opt to go to such areas. You understand? And then we should have this system of training and retraining so that we have surplus personnel around
to do that.
Nurses and all the members of the health team.
Okay, let's hear from Emmanuel, who's calling in from... Okay, Emmanuel, I believe. Okay, that call also is dropped. So, well, if you can still make it, well, we will be here to respond to the issues you might raise, but those calls from Mary and Emmanuel, unfortunately, we lost those calls. But back here in the studio, as we prepare to wind down, we have looked at how beneficial the scheme can be, and you have talked about it being commendable effort by the government. The big challenge is following through and getting it implemented and monitored. But an aspect, one of the callers, or more than one of the callers raised, is to do with education. People getting to know and people being educated about ownership. So it doesn't end up as, well, they've cited it, and whatever they do, not them sabi, as they say in popular parlance. So the people can also keep an eye
to own it.
To own it. Then, of course, we did hear about the people who are attending those clinics not being the ones that the clinics are supposed to be targeting, the poor, the poorest of the poor, those in the rural areas. Is it possible, like so many schemes in Nigeria that are set up to benefit a targeted population, and you find an influx from people who otherwise should not be part of that? I'm talking about where you find a facility is located somewhere, and then rather than the rural folks having access, people coming from nearby urban centers, and the influx is much, and deny the rural folks.
With the prevailing situation, you can't prevent what you are saying. It is for all of them, whether they are the poor, the poorest, or they are not. If they have problem, they will want to go in anywhere they can get solution. So I don't think this issue of education...
This was mentioned by one of the callers.
Yes, the need for this education is very important, and the need for the local people to also own it up. And when they own it up with their leaders within that area, the facilities will also know that there are some people who own the facility. So if they want to do one or two wrong things, they'll be very careful, especially with this influence we are talking about. If they know that it's not meant for them, it's meant for a particular group of people, and the people who have owned it up, you know, that will go a long way in preventing such influence.
Right, so in the final moments of this program, let's take a general look at the health situation in the country, what the country needs to do to improve on its health services and to improve access, and of course to upgrade generally the health system in the country. Dr. John Towagbidie, let's begin with you.
Well, I will call on the federal government to take into cognizance and implementation what we call the Abuja Declaration. The truth is less than 5% of our GDP is actually spent on the health sector. And this is not right. It will not take us anywhere. And we have identified, the problems, especially when you talk about health care delivery in any nation. The primary health care system is the nucleus. So the primary health care system should be reinvigorated. And we've identified the various challenges: poor infrastructure, lack of trained manpower, and we talk about lack of accountability, even where the money is released. The lack of accountability and monitoring and implementation to make sure that the results or the desired objectives are achieved. This is very important.
Integration, we have spoken about integration of the various health models which you spoke about. Even the president, last year in December, the president of the Federal Republic did quote, we should eat and grow what we eat. And they need to bring in all this integrative aspect. He even quoted the name of the DG of the Natural Medicine Development Authority, Professor Martin Semeje, off-head in his presentation. So what has delayed the president's directives from that December till now? There's a need to bring all on board. The integrative medicine, the complementary and alternative medicine and all that are a creation of WHO. Individual countries did not sit down to create this. And elsewhere, they are doing very well. So why will we not do the same here? Some people will load it upon themselves. This will not see the light of the day. WHO is the leader of the health system all over the world. And WHO is the one that has supported these different divisions. And we need to consolidate, we need to bring them together in Nigeria with our powerful ecosystem. We have one of the best ecosystems in the world. Do you know that herbal medicine is going to over $6 trillion by 2030 to 2050, as projected by America? And 48% of this business is in the hands of the foreign people, whereas the raw materials is here with us. The ecosystem in Nigeria is fantastic. And that is where we entered to get the cure for COVID. And the anticipated bird flu. We already have the antidote in Nigeria.
Well, gentlemen, I'd like to thank you for being part of it. But just on a final note, a quick one here. And how much attention are we paying to research?
See, that's where you are, who you are. We should lay emphasis on research.
Yes.
And there's what we call R&D.
At all, zero.
Research and development. Any country that does not embark on research is really
it's a goner
to a doom. So in proposing the solution for the federal government to take note is to push integrative medicine, push R&D, and improve on the infrastructure. Providing funds is great, but the funds do need to be provided in quantum. Thank you.
It is on that note, we must end this conversation. As I always say, no one program can take care of all the issues. There'll be another opportunity to expand this discussion. And so we'd like to thank our guests for coming on and sharing their knowledge with us today. Dr. John Toagbidi, integrative medicine specialist, thank you for coming.
My pleasure, always my pleasure.
And Professor Ben Amodu, Professor of Phytomedicine, we thank you for availing us
it's my pleasure.
Knowledge.
It's my pleasure.
Thank you so very much. Thank you also to those who called in. Appreciate you being with us. Next week, we'll be back with NTA Tuesday Live. I'm Cyril Stober. Bye for now.